Thursday, we're taking a look at health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, colorectal cancer, and it's also called colon cancer.
Colon cancer.
Okay, can you first of all explain what it is?
Okay, cancer again is where cells in the body grow without limit and they lose their function. So an eye cancer doesn't see. A brain cancer doesn't process in the brain the way it should. And then the third characteristic of cancer is that it spreads distantly in the body to create another tumor. That's called metastasis. Now, colon cancer, Christine, is an exception to the rule because unlike some cancers which grow from 2 cells, which 4 cells, 8 cells, etc., colon cancer starts as a benign adenomatous polyp in the colon, which you can take out, and we'll talk about that in a minute.
Okay, and then the numbers, how deadly is it? How many cases do doctors diagnose every year?
It's the second leading cause of cancer death in both genders put together in the United States and in Hawaii. In the United States, there are 135,000 new cases a year, of which 50,000 die.
And what are the symptoms for colorectal cancer?
The most common symptom is none at all. After that, it can be sort of a diffuse stomach pain, bowel movements which change, either constipation or diarrhea or alternating, blood in the stool, feeling weak, a low iron count in the blood test.
And when are you at risk to get colon cancer?
Risk is when someone in your family has had colon cancer. There are some genetic disorders which really predispose to colon cancer. There are age, of course. Young people generally don't get colon cancer. And then there are some diseases like Crohn's disease and ulcerative colitis that raise the rate of colon cancer.
And because sometimes you don't see any symptoms, is there a way you can screen for colon cancer?
There is.
Good.
And that's because the adenomatous polyps exist, which are not yet cancer. And Christine, 50,000 people in the United States do not need to die. So basically, starting at age 50 or at age 40 if you have a family history, you go in and you have a colonoscopy. I've had 4 of them. There have been 2 times that they got precancerous polyps in me. You hemo the polyp, take it out, and you don't have to have surgery, no radiation, no chemotherapy, and you get another colonoscopy in 5 years. And basically, hopefully, I'll live a long and normal life. And unlike my father who had colon cancer, I won't suffer from that condition. So colonoscopy is really important if you're over 50.
Well, we hope you are with us for a long, long time.
Thank you. And we also have these cards, which I call doo-doo cards. They're basically stool cards that we do annually.
There we go.
You can collect them yourself and then bring them to your doctor or the lab, and you test for micro amounts of blood in the stool. And that's another way of testing for colon cancer.
So you put the stool in here, and that's how they kind of screen for it?
It is.
Okay, very well. Anything else that patients or people out there should know about this type of cancer that they might not know?
Get your colonoscopy. Get your colonoscopy.
And this is men and women?
Both men and women.
Okay.
It can't be overemphasized. Imagine 50,000 less deaths in the United States.
I think it's overlooked, underestimated. And next week you'll be back with us?
Asthma.
Asthma, that's another one that affects a lot of people.
A lot in Hawaii in particular.
Kids and adults. All right. Well, thank you so much, Dr. Brady, as always, for your time.
My pleasure.
Have a good weekend.
Yes.